Hello, everybody, and welcome to another AlgaMed webinar. My name is Dr. Freddie Garcia, and today we're welcoming Dr. Tammy Recesso. Dr. Tammy is a licensed physical therapist and a multiple private practice owner for over 24 years. She's also a global speaker and educator, having taught in London, Saudi Arabia in 2025, and scheduled to speak this year in Cape Cod, where I just made plans to go see her. I'll be in Cape Cod this summer as well. I'm going to see her. She's also scheduled for Budapest. Please take me there too, Dr. Tammy. I'd love to go. Switzerland and Thailand. So this is not her first rodeo when it comes to presenting at a high level. She's very passionate about treating the root cause of things naturally. And by the way, she's also an expert manual practitioner, manual therapist. So she is very talented, very gifted, and a great presenter. So I'm excited about this. Today's webinar topic is non-invasive neuromodulation and pelvic rehabilitation, clinical observations in patients with urinary incontinence. Now, Dr. Tammy, I got to tell you, I'm intrigued by this topic because for those who know my story, I missed the boat on pulsed radio frequency delivered transcutaneously with the Stimpod years ago. I didn't understand it, didn't even know how to use it. And now I understand it very well. I teach people about it, how to get successful in their clinics. And they know that it's amazing for chronic intractable pain. That's pain that's really challenging for people, or pain control due to rehabilitation. But then there's innovative clinicians like you who find new ways to apply this based off some other experiences and some other science. So I'm very excited about learning this. And I got to tell you, with almost 200 people registered for this webinar, they want to either see the recording or coming in live. I think there's a lot of people who want to learn more about this. So I think you're going to blow everybody's mind today. Dr. Tammy, you ready to do this?
I'm ready. Thank you.
So Dr. Tammy, this is the way it's going to work. I'm going to turn off my camera and my microphone. I'll be watching in the background. If I have a burning question, I may interrupt you, but I'm going to let you take the stage and I'll be back at the end with some follow-up questions. Does that sound like the plan?
Sounds great. Thank you.
All right. Have a great presentation.
Thank you. Hello, everyone. Thank you for joining me. As Freddie said, I am Dr. Tammy Recesso. I'm a licensed physical therapist in Massachusetts and New Hampshire, and a multi-private practice owner, also a global educator. Today, I'm going to share some really exciting findings based on my patients' information and reports immediately after even just 1 to 2 sessions of the Stimpod at the femoral nerve. They're reporting significant improvement and reduction in urge and stress incontinence. It is life-changing per all of my patients, so much that we were inspired to share this with everyone and create a study around it that we will be publishing. And today I get to present it to all of you for the first time. So today's study is called Non-Invasive Neuromodulation in Pelvic Rehabilitation. And they're based again on my clinical observations with my patients that have the reported urinary incontinence prior to treatment. And again, my background, I have over 30 years of clinical experience, 24 years self-employed private practice, and I own several private practices in Massachusetts and New Hampshire and teach globally now. I developed a Doc Tammy method, which is a method or a protocol, if you will, on how to treat each body part naturally, how to rule in or rule out neurological component versus musculoskeletal component, and how we can treat naturally without needing unnecessary opioids, pain injections, and unnecessary surgeries. So I'm really passionate about that, and I teach that globally. So when I was in London last year teaching, I stumbled upon the Stimpod, and Dr. Collins was there at a conference, and I was able to trial it for myself. And I was very skeptical, I will say. I'll be honest with you. And once I tried it for myself, I was like, oh, okay, yeah, this really does activate the motor response. And I did feel a little bit better afterwards. And then what really struck home to me was when I was talking with a physical therapist over in London. And she told me that after one session, she was able to go for a run the next day without any urinary leakage. At that moment, I knew this was something really big, really important, and life-changing for these people. super effective, so much that I actually started using it in my clinic immediately on return. I used it with a couple of friends of mine first who had also suffered from urinary incontinence for several years, wearing pads every single day and leaking constantly. And after one session with them, they reported about 85% improvement. And at that point, I said, oh my goodness, I'm definitely going to promote this in the clinic, and we're going to treat more people and figure out how this works and see how effective it is with other clientele. I have another accolade in my history. I also served on the Olympic and Paralympic medical team in the 2000 Sydney Summer Games. And I also published my book, The Art of Manual Therapy, which is also offered on eCourse to learn the methods and protocols that I've put together to heal sciatica and correct pelvic asymmetry, etc., naturally with different osteopathic techniques. So, to get to the good stuff here, to talk more about what the baseline is, the current understanding of neuromodulation for urinary incontinence. What we already knew was neuromodulation, also called PTNS. It carries a grade A evidence from the American Urological Association for overactive bladder and urinary incontinence. The recent systematic reviews do show that the tibial nerve stimulation does yield a 70% responder rate. And the mechanism, based on Nature Reviews in Urology in 2024, talks about the modulation of the pelvic reflex arc via three primary pathways: either suppressing the hypersensitive afferent signals, which is therefore reducing the urgency, promoting spinal guarding reflexes, which is maintaining the sphincter tone on the bladder, and modulating supraspinal regulatory circuits, which is therefore restoring central nervous system control. So this is already known prior to my study. And for the anatomical targets, based on some of these studies, it's promoted to target the tibial root. The tibial root originating from L4 to S3 spinal segments, sharing the nerve root center with the bladder and pelvic floor. With my patients, the way I was instructed in London was to trial it at either the tibial root or more proximal femoral root. And based on my experience, I preferred to be more concentrated right at the femoral root, which is right at the underwear line where your pelvis meets your leg in the front of your body. Super simple. Patients stay dressed and they're just bringing their pants down. They keep their underwear up, and we just put the probe right on the femoral nerve, right at the underwear line. And we put the dispersive pad right on S3, right on their low back. So it doesn't have a very far distance to travel, where if you were at the tibial nerve down by the ankle, it would have to go from the ankle all the way up to the S3 as well. So the way I've treated is femoral nerve right at the underwear line, right to S3 dispersive pad, very concentrated, and it seems to be very effective based on my patients' reports. But why is it so effective? So a comprehensive review here for the current standard for the comprehensive review in the Nature Review Urology synthesized research on the exact mechanism, concluding that neuromodulation modulates the pelvic reflex arc via three primary pathways. So discussing this a little bit further. So again, suppressing the bladder signaling. So the sensory information that goes from the bladder to the brain is reduced. Okay, so that'll reduce the sensation of the urgency. The other one that we talked about was promoting the spinal guarding reflex, which helps maintain that tone And then the third was the modulation of the supraspinal regulatory circuits, which is helping restore the overall function. And we'll talk more about how the Stimpod specifically actually does help correct the nerve with its anti-inflammatory benefits as well, through the pulse radio frequency wave. So we'll get into that as well. And in short, we're leveraging the body's own neural highway to restore the coordinated bladder function. And based on results and reports from my clients, it's working. It's working, and it's working really, really quickly. Again, 1 to 2 sessions, maybe 3. And these ladies are having immediate results. And it is quote unquote life changing. I've had people in tears, just like they cannot believe that they're not leaking anymore, or they're not having the urge, or they can get to the toilet on time, without peeing their pants. They said it's really, really life changing. They're not planning their entire day around, oh, where's the nearest bathroom? Okay, I can only take this amount of a drive. Is there a bathroom halfway? So honestly, it's really life changing for everyone. So we have the clinical gap is the current standard, as we talked about. The traditional PTNS often relies on 12-week protocols with multiple sessions per week. And the difference here with the Stimpod 460, the NMS 460, is that it's working so quickly. It's working in 1 to 3 sessions for these people. It's not a 12-week protocol. We're getting better carryover. I think in the other 12-week studies, there was less carryover because people weren't, the continuity was interrupted by daily life, or just lack of continuity coming in to the office for the treatment. And they're also a lot more invasive at the tibial nerve, according to some of the studies, with a needle going into the nerve. So it's a lot more painful as well. Whereas the Stimpod is pain-free, and it's actually, when it's placed right on the femoral nerve at the underwear line, it elicits a quadricep contraction. And we're finding that once we put it on level 2, which is a deeper level, we're getting up to 28 to 30 for the maximum amount of stimulation, and to get a contraction on the quadricep. And of course, it gets to be pain-free as well. So if it is painful, we just lower it a little bit. But the best findings that we've seen are on the level 2. And that is consistent with a lot of the research. Okay, so we have the case study number 1. This woman, she's actually, the findings here are based on 2 sessions. And she just recently came in for her 3rd session this week. And she has told me, again, life changing. I know I've said this many times, but it's been amazing to really help these people so much. And it literally takes 10 minutes. So it's very quick, very easy, pain-free, and takes 10 minutes, and it's changing lives right now. So this is really groundbreaking information. So this woman, case study number 1, she's a 70-plus-year-old female. She was leaking 3 to 4 times a day and waking 2 to 3 times per night. She wore pads 24/7. She had 1 session for 10 minutes, and it was at 28 to 30, as I said, in point 2. And she texted me the next day and said, "Oh my goodness, I just sat at a lunch with my girlfriends for 3 hours, and I didn't have to get up to go to the bathroom," where she would have gotten up to go to the bathroom probably 3 times within those 3 hours. So it was very, very significant, very quick turnaround in recovery. And she did come in for another session about a month or so later. And she did find some improvement then, and now she's come in for a 3rd. So we're finding that it is helping when it's performed, right away, it's helping. And then we're seeing some results around like a 3-month 3 months of relief or so, sometimes a little bit longer, sometimes a little bit less, depending on the person and their history. So the outcome here on the scale is she noticed improvement 10 minutes after the session, and even at a 5-day follow-up, her urgency was completely gone. And long term, she would still say today, I think she said earlier this week, it was about 95% overall improvement. And she's like, well, when do I come back? Do I wait until it comes back really bad? Or do I wait? Do I come back when it first just peeks its head out or something? And I said, you come back whenever you want to come back, and we'll do another one for 10 minutes. So it really, really amazing, amazing findings. And I'm just so excited to share all this with you today. So the next study, case study number 2, this woman, actually, it was interesting. I conduct a lot of free workshops in my clinic for patient education and, around neuropathy and urinary incontinence, etc. And there was a gentleman in my audience who has a wife that has urinary incontinence, who's also an RN. And that's this woman here. He actually went home and told her all about it. She booked an appointment the next day because obviously this is a significant issue for her. And again, she had significant relief immediately. And she came in for another one the following week, and she was up to 100% improved. They decided to purchase a unit so that she could self-treat in the long run. So that worked best for them instead of coming back in. And she's just so excited. Their daughter is also a physical therapist, so they'll be spreading the word that way as well. So more information about this study. She's also a 70-plus-year-old female with extreme hourly urgency, and she relied on deep breathing and crossing her legs to stop the flow. She had been seen by a pelvic health specialist 10 years ago, and it just so happens to be the same pelvic health specialist that's now in my office, which is really interesting. So she learned all those breathing techniques and a lot of the tips and tricks with pelvic health. And with one session of Stimpod, she was so much better. And with 2, she was almost 100%. So you can definitely see the difference here we have a standardized scale of the IIQ-7. Her score went from 57.14. And after one session, it dropped to 0. So that's pretty significant. She had an 80% overall improvement. And we quoted her as, I have lost the urgency when I'm walking to the bathroom. I haven't had any episodes where I have to cross my legs. So again, very, very significant. She didn't require as much stimulation. She was at 13 milliamps at 0.2, whereas some ladies, I'm able to turn it all the way up to 30 without any discomfort. But again, it gets to be pain-free, it still works as long as it's at the 0.2 milliseconds. And we bring it up to comfort, but enough so that we can feel a contraction in the quadricep. So case study number 3, I have my notes for who these people are. Okay, so this woman, 70-plus-year-old female, she actually suffered a spinal cord stroke. That was about 2 years ago. She had a significant effect with drop foot and some hemiparesis. And she was walking with a rollator walker. She had recurrent UTIs, extreme urgency, and she had a UDI-6 score of 50.00. We intervened along the bilateral femoral nerve, again, right at the underwear line, anterior. And we also treated her for her drop foot and her lack of strength with plantar flexion, etc., and some numbness that she was experiencing as well. So we treated her for a few things with the Stimpod. And We've noted a lot of her information here, just to consider all of the interventions. She had reported 75% overall recovery over the course of treatment. And quality of life, she's no longer actively planning her day around the bathroom. And she went a month and a half without a single UTI. And this is a woman that had been on continuous antibiotics due to recurrent UTIs after the spinal cord stroke. She was significantly affected with the spinal cord stroke. And the Stimpod has really saved her life, in terms of helping her regain the proprioception and awareness in her foot and leg. It's helping her get around. She's actually on a plane right now to Florida to go vacation. And this is her second time down there with her husband and meeting friends. So she's really back to living a normal life versus really being housebound. Like, she couldn't come to my Christmas party last year because I have stairs to enter my home. So now she's able to do a lot of that. And that's also with other therapy and whatnot as well. But the Stimpod has significantly affected her urinary incontinence, her overall health with the infections, and also her ability to walk now. She's using a cane, a straight cane with a small quad adapter on the bottom versus a large one, and she's not using the walker anymore at all. So really, really significant, life-changing again. I'll say it again because it is really life-changing. That's what I'm hearing from everybody. And that's why it's so important to share this with all of you. And please share this with all of your coworkers and other providers, because this really is working. Okay, so now we have case study number 4. She is a 60-year-old female. She wore a Poise mini pad daily, and she reported leakage triggered specifically by laughing, coughing, or sneezing. Her UDI was 27.78, and her IIQ7 was 14.29 initially. She had 3 sessions along the bilateral femoral nerve, and she was also treated at the glute medius because she was having some hip pain, and the Stimpod is FDA indicated for pain control and whatnot as well. So we figured we would give it a try, and she did have some really good results with that as well. She noticed a specific relief with laughing and coughing, and described as better than a constant leak. And she also reported 75% improvement overall long term, where currently her UDI dropped to 16.67 and her IIQ7 dropped to 9.52. So again, really, really great outcomes. I have other women that I've also worked with that are not included in this study. I'm continuing to treat, and we're continuing to get so much feedback around how helpful the Stimpod has been for them, and they're really, really surprised at how immediate the outcomes are shifting. I have one woman who actually told me a really funny story. She texted me the day after her first Stimpod, and she said, I was on the phone with my girlfriend for like 3 hours, and we were belly laughing, like crying. And we were having so much fun that my girlfriend said, oh my gosh, I peed my pants. And this patient said, oh my gosh, I didn't. So, so remarkable. And it's just been so fun to hear all of this and just to help so many people. So again, we have the combined figure of the 7 cases that we used. And you could see here on the graph from the self-reported urinary incontinence severity as percentage, and then the times days from baseline. So we've studied all the way up until 120 days after the first session. And what we're seeing is there is definitely, a variation in urinary incontinence triggers with all sorts of ladies so far, ranging from stress incontinence, like laughing and coughing, to all the way to a 24-year history of a post-hysterectomy leakage, spinal cord stroke, and patients reporting substantial improvements in symptoms, often following just 1 to 3 sessions. So really significant and definitely a lot faster than the 12-session protocol that is known to date. So our key takeaways today, based on these clinical observations, is again, unlike the 12-week protocol, most of these clinical benefit was observed within the first 1 to 3 treatments of literally 10 to 15-minute sessions. And the potential neural pathway engagement, where these rapid results are consistent with hypothesized mechanisms of actually suppressing the bladder afferent signals and or promoting the spinal guarding reflexes described in the current literature. Overall, we're seeing a subjective positive response so far. Patients reporting an average subjective improvement ranging from 65% to 90% reduction in urinary leakage after 1 to 3 treatments of the Stimpod. And the next steps are these preliminary observational findings definitely warrant formal prospective randomized control trials to establish standardized protocols and validate the efficacy in a larger sample. And these are my references.
Perfect. If anybody wants to snap a picture of those. Dr. Tammy, I turned my camera and mic back on. Can you hear me?
Yes, I can. Thank you.
Okay. Dr. Tammy, listen, we got a flurry of questions to ask you. Can I rapid fire you some questions?
Sure.
Okay, awesome. This is gonna be good. All right. I did my best to jot them all down. I answered a few. Okay. So what is the reason for using the Stimpod on both sides? Like everybody's trying to hone in on your exact protocol. Seems like you favor the femoral nerve. Do you do that bilaterally? And some people noticed it said 10 minutes. Are you doing 5 minutes, 5 minutes, or 10 minutes each nerve? How's that work out? And then it seems like you like the point two setting. You prefer that over point one. Can you confirm that for us?
Yes, definitely point two. We did have one woman that did not report improvement, and she was point one. And I think that's really consistent with the research and the findings that it gets to be a lot deeper. So definitely point two. And then it's 5 minutes on each femoral nerve, 5 minutes, and then 5 minutes on the other. It's just the way that I was taught to use the stim pod was to cover both sides if they were having trouble bilaterally. So, like, even if somebody had neuropathy in both feet, we would treat the nerves on both limbs, regardless anyway. So, it just made sense to me that you'd treat both femoral nerves. I haven't trialed it with just treating one of them at this point.
Okay, perfect. Treating position, are they seated or do you put them supine for this?
I prefer them supine, sometimes in a little bit of the beach chair position, but not too much, depending on the size of the individual, so that we can really get to the superficial femoral nerve.
Yep.
So yes, they're pretty much all supine to slight beach chair, maybe at like 20 degrees of the trunk, the flexion.
Okay. I want to make sure that I may have missed this, but what type of incontinence have you seen this help with your population? Stress, urge, or a mixed variety?
Everything, everything. We've seen
Okay.
all three.
Okay. Perfect. All right. The question that we started as soon as we announced this webinar, we started getting this question in our email, like probably more than a dozen a day. And it's this: everybody's asking about different patient populations. So I'm going to rattle off some patient populations, and we're theorizing here because of the anatomy and the physiology. But is there
Yes,
a chance that this may help children with nocturnal enuresis? I,
definitely.
I think that's it. I think that's interesting. From physiological perspective, I would I've actually heard of protocols with other electromodulation devices to help kids with
Yes.
that still delayed nocturnal enuresis. But the way you're applying it makes a lot of sense to me. So I would venture to say that I think we would see some success. So I'm glad to see you in agreement there. Okay, the puck, I got this one a lot. They want to know, one, does it also help men with incontinence issues? Have you tested that yet?
I haven't had any men sign up yet, and
Okay.
it's not that I've been deterring that. They just they haven't signed up for any treatment. I do have one gentleman that has prostate cancer, and he had prostate surgery. However, he hasn't had any treatment yet. So that'll be something that we trial in the future.
Okay, excellent. Because so great. I want to see what you come up with there, and especially I love the way you're keeping all the data and you're doing your outcome assessment questionnaires. That's perfect. Okay, another question you're getting a lot of men chiming in. They want to hear about the prostate issues. Could it help with them? They're talking about in more populations, other pelvic conditions, and then also ED, erectile dysfunction. Can we theorize that this may potentially help them? Again, off-label use, but from
Mhm.
physiological perspective, can you theorize that this may be helpful based off what you're seeing?
Yes, yes, especially when you understand the science behind it with the pulse radio frequency is actually an anti-inflammatory component. And it's getting in there to almost reboot the nerve. So if the nerve is interrupted for some type of a reason of anti-inflammatory or just less conductivity, yes, as long as the nerve is viable, it's worth a try, I would say.
I agree with you, Dr. Tammy. Dr. Tammy, one last question from the peanut gallery is why the femoral nerve versus the tibial nerve? Because what I've seen previously is the tibial nerve with that long loop. I think you actually had a picture of it, and you have a preference for the femoral. Again, can you remind us why your preference for the femoral nerve?
Just to be more concentrated, because we're delivering from the pen to the dispersive pad, so it's right there. It's a lot closer and more concentrated, so you can directly affect
Hmm.
that. And that's just the nerve that it was recommended to me when I talked with the woman in London. I believe she had it on the tibial nerve, but I was told you could do either one, and I said, well, why not just go more towards the root?
Awesome. I love that. And you're going off your experience, right? Which is
Yeah,
valuable as
yeah,
well. Dr. Tammy,
exactly.
thank you so much for answering all those rapid fire questions. To everybody.